Okay, thank you. 8:38, time for our Health Watch. And as always, we are joined by Dr. Syed Hussain from Trinity Health of New England, albeit remotely this morning. Doctor, good morning to you. How are you today?
Good morning, Tim. I'm great, thank you.
Glad to have you here. We got a lot of good stuff to talk about, including the zero suicide model. I guess there's a new study out there that suggests healthcare systems can reduce suicides and have reduced suicide rates through a combination of patient screening, safety planning, and mental health counseling. What's up with that?
Yeah, thank you, Tim. And I'm glad we're shining a spotlight on behavioral health issues, especially suicide. We know it's the 11th leading cause of death in the United States. And so this study goes back a few years where multiple healthcare systems have put interventions in place. First is to identify patients at high risk for suicide, and then making sure that their access to lethal means such as firearms is reduced, and then following up with treatment. We know that those individuals that do die from suicide have actually seen a healthcare provider within the last 1 year. So it just goes on to show, it adds to the growing body of evidence of how wrapping our arms around these vulnerable patients with interventions and safety mechanism can make outcomes better and prevent suicides.
Did that surprise you, or was that very informative to you that the study seemed to found that almost universally suicide victims had seen a healthcare provider in the previous 12 months?
It doesn't surprise me, Tim. It just shows you that there's multiple things that happen before someone actually takes that drastic step. And that's why I say having those wraparound services and support structure for these vulnerable patients, identifying them first, by the way. Not patients don't generally come and say, you know, I'm feeling really, you know, I have a plan, I'm feeling suicidal, et cetera. So that's part of the challenge here, is to identify those susceptible patients and then making sure we have enough interventions in place to help protect them.
Got it. All right, moving on. There's a vaccine designed to stop a painful virus that can give you shingles, but turns out it may also help to delay dementia, at least according to a new study. What did that study find?
Yeah, this is interesting. This is from the United Kingdom, looking at patients in Wales. In a nutshell, this is looking at patients that are either above 80 or under the age of 80. That was the cutoff in the UK for adults getting shingles vaccine. We know this is the same virus that causes chickenpox in children, and once you do get chickenpox, the virus stays. It hides in the nerves, in the nervous system, and then can reactivate later in adults, causing shingles. So this study basically found those adults that did get the vaccine had a 20% decreased risk of developing dementia in the next 7 to 8 years. You know, there's more study and research needed, obviously, but it points to something, you know, more on the preventable side, where we know shingles vaccine uptake in U.S. adults is pretty low. The CDC recommends if you're above the age of 50 to get the 2-dose vaccine, which is the doses are several months apart, but it's important, and this just adds to that body of evidence.
Last topic. Hey, it is absolutely spring allergy season. Personally, I always get confused as to which allergy medications you should be taking for sort of like acute symptoms versus which ones you can take every day leading up to spring to maybe try to stop allergies. Is there even a difference? Because I know you got Claritin, you got Zyrtec. Those are two different kinds of medicines, and then there's nasal sprays. I tend to get confused. I imagine a lot of viewers do as well. Can you help clear that up?
Yeah, great question. So before we go to treatment, let's talk about prevention, because I always like to think, okay, how can we prevent these symptoms from developing? So if you're getting nasal congestion, itchy eyes, you know, hives, typical symptoms associated with allergies, and you know it's allergy season, then look at what the pollen levels are. For instance, there are apps that track that in your local neighborhood. If they're high, then when you're coming out home from outdoors, take a shower, keep those windows closed, wear a tight-fitting mask when you're outdoors. Those steps can help. And now when you do develop symptoms, first and foremost, always talk to a healthcare provider. But there's nasal decongestants which have steroids, for instance, that can provide quick relief, Flonase, for instance. There's antihistamines, which can tamp down inflammation and symptoms caused by the release of histamine in the body. And so medications related to that, Benadryl, for instance, can cause a little bit of drowsiness. There's Claritin. And then there's decongestants available. And then for those patients that don't do well on any of these medications, their symptoms continue, then there's immunotherapy, which is actually done by an allergist. So your healthcare provider will need to refer you to an immunologist, allergist, to see what may benefit. But going back to prevention, though, it's always better than the cure, but there are medications available to help you with symptoms.
Okay, we covered a lot in a short amount of time. Dr. Syed Hussain, thank you for joining us over Zoom this morning. With a busy schedule, we always appreciate the time.
Thank you for having me.
Good to see you again. We'll see you next week.